Hey guys, my name is Nicholas and I'm the clinical supervisor here at the Center of Dental Professionals. Today we're going to go over what we need set up for a basic restorative, which is a composite filling. So there's a few things you will need getting that treatment done. You will need a cotton tip applicator. This is used to get a topical to place in the patient's mouth before you numb them. It helps patients calm down and help them not feel the needle goes in. There's also some cotton rolls. It helps isolate the tongue and also the cheek. We have some triangles over here to isolate the cheeks. And we also have some solid high volume suction here. This is your saliva ejector. And then you'll have some air water syringes also. Okay. And then with the instrument side, we have a syringe. This is used to numb the patient. Now, it takes two different kinds of anesthetics. The first one is a septicin. It has a little gold bar or ring around it, and it is used to numb the top. It goes with a short needle. This is used to numb the top or to numb anybody who has a hard time getting numb. We also have a lidocaine for the bottom, and it usually takes a long needle, and it's called a 30 gauge needle. Alright, and so here is how you set up the anesthetic. You get your syringe, pull this back, the top part, pull it back. So we're going to pull it back and then place the septicin in there. And as you can see, because I pulled this back, I have room to move it around. So once you have it pulled back, push down to engage, open your needle and then place it in here. Be really careful with it and make sure you don't stab yourself, and then just tighten it. Once you have that tight, just hit on it twice to engage it. We have a mirror, an explorer, and you have a spoon excavator. You will normally have two on here, a small and a medium one. This is used to clean out any decay after the tooth has been pricked. You have a ball burnisher to pack the composite in there, and then you also have a plastic instrument, or some doctors call it a beaver tail because of the tails are at the end of it, and this is used also to help pack instruments. And we have some articulating paper. This is the articulating paper holder. This is used to check the bite, usually on occlusals or the front teeth, to make sure the filling is not too high and the patient is not biting too high. We have a spatula to mix any cements or powder, and you also have a cotton holder. You use this to grab the cotton pliers to place in the patient's mouth. We have here a micro brush. This is used to get the top of the bond, and this is the bond. We have different kinds of bonds, so ask the doctor which one he prefers. You put this in a dapping dish and you dip it with this one. Okay, and then we have a flowable composite, your composite gun, and as you can see, we have a packable composite in there. So the way you do it, the gun has a little hole in front. So you take this, place it in there, and you push down on it. Okay, and we'll have some bite block and some burrs also. We'll have this here. This is called a matrix holder. It is used to go in between the teeth, usually for mesial or a distal. And it takes a matrix band. So the way you set it up, it has a little ring in front. So you just place it in here to come to the side based on where you're working, and then you tighten this part. And if you don't know how to, you can ask the doctor. They will be happy to show you how to set it up. We have floss. Every time you do any interproximal fillings, you want to use this to floss in between the teeth to make sure the patient can floss when they go home. All right, so this is how you set up for a basic restoration. Lastly, but not least, when taking off the needle, the way I do it to make sure I don't poke myself is I twist this first. Once I have it disengaged, I quickly bend it to make sure the needle part is bent, and I place the cap on it immediately so that I don't risk any chance of poking myself before I take out the syringe and dispose it in the sharp container. Thank you so much and hope to see you soon.